Hi guys, Tara Scott with Revitalize. I'm talking about bone health and osteoporosis. So some of the therapies that are indicated for osteoporosis, one of them is estrogen. And we have a different set of categories for estrogen therapy. We don't necessarily prescribe it for someone who's over 60 if they have osteoporosis, but knowing that we're being proactive, that is one of the benefits. And estrogen is something that has actually been shown to reduce the risk of spine fractures and hip fractures. And it's one of the things that actually prevents your bones from breaking down. Other things is something called Evista or raloxifene, which is a selective estrogen receptor modulator. There's been a lot of buzz about that particular medication because it's indicated for osteoporosis, but there was seen to be a great reduction in breast cancer in patients who had a family history of it because it's an anti-estrogen in the breast, but doesn't stimulate the uterus like tamoxifen can. So that's also an option. It's a daily medication. The medications that are notorious for bone health are things that are bisphosphonates. So the way they work is they actually prevent and treat because they work to stop the bone breakdown. They don't necessarily increase the bone health though. And so there's a category, several of those, depending on if you take it once a week, once a month, and they have also been shown to reduce the risk fractures of the spine and the hip. The problem with those is there seems to be a shelf life, maybe not a shelf life, but a time limit on those, that after so long, that's when the risks increase. So those are generally medications we want to reserve for when you're an older person or when your osteoporosis is more severe. And in my opinion, there are a lot of side effects, so I'm not even sure that it'd be something that I'd want to take anyway. So just know that there are different options. There are some new medications that actually can be given IV. One of them is Zometa or Zolendronate, and that's a yearly infusion. The problem with that is you have to have failed other medications first, generally. And then there's one that is a sub-Q that's actually parathyroid hormone. These also have risks that they might affect the bones of the jaw as well. So we've got to be really careful about some of the new ones. So let's talk about a more natural approach to osteoporosis in the next video.